Okay, so I've gotten my patient up to a chair, a bedside chair. It's the best I could do for a bedside chair. And I want to point out, go ahead and lift your foot up so they can see the bottom of your socks. We need to be sure, these are grippy socks, put it in. You need to be sure that your patient has some kind of anti-slip footwear on before you transfer them or walk with them. And grippy socks are what we'll be using in the lab practicals. You'll see them in the hospitals everywhere. People may want to wear their slippers, but you need to be careful with that because slippers are not real supportive and they don't necessarily have an anti-slip sole on them. Better is to put shoes and socks on them if they're available. Anyway, so Scott is going to be up in this chair for a while. He also had, let's say that he had a total hip replacement on the right. So the first thing I want to do is, because we always work from the pelvis down or the pelvis up, I'm going to fill up the space that's created by his lumbar lordosis with a towel roll. I'm going to have you lean forward a little bit and come on back. How does that feel?
Good.
Okay. So one other thing we want to do is make sure that his hips are back in that chair as far as they can go. So can you just scoot backwards a little bit? Scott also had an anterior approach to his total hip replacement, so he does not have hip precautions. He can lean forward. The other thing I want to do is make sure the feet are, or at least his left foot is flat on the ground. This helps to stabilize him. You wouldn't want to leave his feet dangling for several reasons. One is contractures, but the other is you can get dependent edema and you can get too much pressure underneath the thighs. Now ideally the seat that he's sitting on would maybe come out a little bit further to help reduce some of the pressure on the ischial tuberosities. And speaking of ischial tuberosities, if this is a fairly hard surface, he may be more comfortable sitting on a cushion or on a pillow. Because he's had a hip replacement on the right side, he's going to have some swelling in that leg. So I really don't want to leave him up for an hour or 2 hours in this chair because this, without elevating that leg, because this is going to be uncomfortable for him. So how do we elevate the leg in an acute care or nursing home setting? And we don't necessarily have good equipment to do that. So one thing that I do is I use a little step stool. And I want to put a pillow or two above that. You okay?
Yeah.
What happened?
I moved my leg to the right
Yeah,
and put it up over the top of the,
yeah.
and that hurt.
Oh, sorry. Don't hurt your patient. Okay, so then you would be able to leave them up for a period of time in this position. Make sure that they're securely on this, that it's not going to fall off, because that would really hurt if you had a total hip replacement. His arms look okay in this chair, but one thing, if you had, most bedside chairs have wooden armrests, so what you might want to do is make sure that he's got some padding for his arms, okay? If he's had a stroke, let's say he had a stroke on this left side, we may want to put something underneath there to elevate this hand. If there's limited motion here, he could get some edema from that. So if you raise that up, the gravity will help to eliminate or help to manage any swelling that might develop. How do you feel?
Good.
Okay. So that's pretty short and sweet. Make sure that if your patient is up in the chair that you give them their call light, so that if they need help or need to get back to bed before you or the nurse was planning on doing it, that they can ring. If they need some pain meds, they can ring. Make sure that their bedside table is close to them, that they have their water, their phone, their tissues, anything that they need to be reading or want to be reading. And one thing that I always do before I leave somebody's room is I take the time to stop and ask, is there anything else you need before I leave? And the reason I do that is because we know that call bells don't necessarily get answered in a timely manner sometimes. So I want to make sure that they have everything they need before I walk out that door.